Myofascial stretching for cervical thoracic pain. Latissimus dorsi stretch. Patient is in a supine position. They raise their arms overhead, bridge their hips up. Clinician supports the base of the pelvis. Bring the knees to the chest, and overpressure is applied by reversing the lordosis, and overpressure is held for the stretch. A self-stretch can be performed in side lying. Patient raises their arms overhead, tilts their legs off the edge of the table, and overpressure is held for the stretch. Upper trapezius stretch. Patient is in a supine position. Shoulder girdle is depressed. Patient's head is flexed, side bent away, rotated towards, and overpressure is applied for the stretch. A self-stretch can be performed in sitting. Patient flexes, side bends away, and rotates towards, and overpressure is applied for the stretch. Levator scapula stretch. Patient is in a side-lying position. Their head is placed in flexion and rotation away. Clinician places one hand at the back of the head and other at the top of the shoulder. Overpressure is applied for the stretch. A self-stretch can be performed in sitting. The patient flexes their head, side bends away, and rotates away. Overpressure is applied for the stretch. Pectoralis minor stretch. Patient is in a supine position. Pressure is placed over the deltopectoral groove. Force is directed into a retracted and elevated position. A self-stretch can be performed in the sitting position. Towel roll is placed between the shoulder blades and they lie back. Arms comfortably resting on their shoulders and the shoulders are retracted. Scalene stretch. The anterior lateral margin of the first rib is identified. A towel roll can be used to apply direct pressure over this location. A downward force is applied while stabilizing the head. Overpressure is applied for the stretch. A self-stretch can be performed in sitting with use of a sheet over the involved side. Patient stabilizes the first rib, initially tilts their head towards the side, and then progresses by tilting their head towards the opposite side for the stretch. Suboccipital stretch. Patient is in a supine position. The clinician supports the base of the occiput and applies a downward force into retraction. One side can be isolated by rotating or tilting the head away from the involved side and further moving their head into retraction. Finally, a bridge can be placed at the base of the occiput at approximately C1, and the clinician can use their shoulders to apply the retracted position. A self-stretch can be performed in sitting by bracing the base of the occiput and tilting their head forward.